Hi, I am Dr. Periyaswamy, HOD of Cardiothoracic Surgery, Sri Ramchandra Medical College at Chennai. We come across that is all the way from Chennai to Vapi to learn, and we want to teach, and we want to gather, and we want to discuss among the Meril Academy, particularly cardiothoracic surgery is come up of that is Indian era, that's Asia. The new valve is come up, that is Dafodil, then apart, that's Dafodil NEO. So now we want to learn a lot about the Dafodil NEO. Same way, whatever the research is coming up each by each, that we can learn a lot of things. Everything benefits by the next generation, next human beings, well-being, everything, all. Science always grown up for that is well-being. So Dafodil NEO has come. That will show that is much better than friendly for the surgeon. Why come across that is what I am telling, that is what friendly mean. That as a surgeon we want to handle the tissue. If always what our teachers forefathers taught us, tissue handling always much important for the any human body. Same way that is this tissue handling for the valve. If the hard structure we can push down, and in the soft structure it's very difficult. That way Dafodil NEO, this say very soft compared to other tissue valves, easy to implant. Another thing that is now Dafodil NEO, they introduced mitral position 23 mm and aortic position 17 mm. Everywhere the debate is going is if you put smaller valve, EOA is almost less, the gradient will be more. As a surgeon, if you come across anywhere, good surgeon always, one thing, safe surgeon is very important. I do heroic surgery, root enlargement, I put a 25 mm valve, patient not come out of the bypass, on table death, that's bad. In spite that, other companies not introduce the 17 and 23 valve is very well useful in crucial situation. I open the aorta, it shows that is 17 mm only is there. If the tissue valve is fit into the 17 mm, that way the Dafodil NEO is helping more and more with surgeons. So for the final, I want to tell you that Dafodil NEO, if you continue the same, that other valves compared to the 17 and 19 valve Dafodil taken and put that is Dafodil NEO in that place, no, definitely help for the surgeons. That's a way. Thank you.